actually to have all of us together in person after a time when that was really challenging. So before I introduce Jason, I did just want to say a little bit about our thinking behind the theme for this year's Economic Summit. As I'm sure you've noticed, it's really focused on the people that are here in Washington County, thinking about workforce, thinking about investing in ourselves and our neighbors. And it comes out of a sense of the time we're in. We're in a time of really dramatic change when it comes to trade policy, when it comes to federal policy, when it comes to, I think, a lot about our economy and our country going forward. And it seemed like a time to focus on basics, to focus on the things that we know will make a difference in this region's economy in the future, which is the people here, or the people who might choose to make this place their home. And so today, from our keynote speech through the plenary this afternoon and the breakout sessions, we really wanted to explore strategies that have been employed here in Washington County that are working, or strategies that could be deployed here that would have impact, that would help our economy, help people here to be more successful, more productive, be able to accomplish the goals that they want to accomplish, which overall is a recipe for a strong and resilient economy. And I'm really excited about that work. I'm really excited that we're all here together to dig into it and to discuss it and to think of what that means going forward. And with that, I'd like to introduce Jason Parent, who is our keynote speaker today. Jason is the Executive Director of Community Action in, I'm not sure if I'll get the order right, but in Aroostook, Washington, and Hancock counties. And for the last 10 years has been the Executive Director and CEO of Aroostook County Action Program. I've known Jason actually for 25 years, back when he was a really strong advocate for the University of Maine at Fort Kent, and really a champion in the St. John Valley for preserving and celebrating Acadian heritage. Jason also in his career has worked at the local chambers of commerce in Aroostook County in the medical field, and since his time at ACAP has really made that agency a national leader in how to integrate services to be more effective, how to treat people or reflect the fact that people are part of families, and when you are serving an individual, you are serving a family. And Jason has had a transformative effect, I think, on community action in Aroostook County. And I think it's really exciting to think of what his whole team and that whole agency, along with so many talented people from Downey's Community Partners, will do going forward here. So with that, Jason Parent.
Thank you kindly, Charles, for that wonderful introduction. And yes, we do go back quite a ways to our days in Fort Kent when Charles was the Economic Development Director there and served on the Chamber of Commerce Board alongside me, and did some really innovative things, including starting the Ploy Festival during that time there, which for those of you who have had ploys, definitely you haven't lived until you've seen the 12-foot world's largest ploy that's constructed every summer and cooked in front of your eyes every summer with huge squeegees to spread it out on the 12-foot diameter grills. So thank you, Charles. I'm very pleased to be here in Washington County today. We have had just a phenomenal couple of days here in community action in Washington and Hancock counties. I'm just so pleased to share with you today that yesterday we held our very first radiothon for the THAW program. And as you can well understand, and as Charles just indicated, times are very challenging right now. And so our ability to access emergency fuel, which typically happens on the 1st of November in the state, has not happened because of the government shutdown. So yesterday we were able to raise just over $40,000 for friends and neighbors here in Washington and Hancock counties in partnership with Star 97, and really be also able to tell the stories of the people of the two counties. We had great testimonials throughout the day, and brought in fuel vendors and others who are an important part of the process of getting emergency fuel assistance into people's hands. And so it was really a gratifying day, but it was also an opportunity, as is today, to share with you about your community action and the great things that are happening with your community action after a challenging period of time. And so again, I'm happy to be here with you and also to tie in the theme of this summit and how your community action agency is really an economic catalyst in your communities in the work that the team, a very talented team of members, and I'm joined by two of our team members here from Washington and Hancock counties that are doing that work each and every day and have done that work uninterrupted throughout the past year. And so very, very proud of that team and the work that they are doing. I wanted to start by providing you with an update and letting folks know where things stand with your community action agency at this point in relation to what is happening with what was Down East Community Partners and Aroostook County Action Program, now known for the time being as a really long name of Community Action in Aroostook, Washington, and Hancock counties. First, contrary to what you may have heard about in the media and what's been reported in the media, this is not a merger. We have not merged Aroostook County Action Program and Down East Community Partners. What we have done is we've worked very carefully with funding sources, Maine Housing, the Department of Health and Human Services, and others to transfer the contracts for Washington and Hancock counties to the entity that is currently Aroostook County Action Program. In so doing, we've gone from 144 team members in Aroostook County alone to 210 across the 3 counties. And this statistic takes my breath away. We do collaboratively cover 35% of the state's landmass. So if you look at a map of the state of Maine and you plot out where community action agencies are in the state of Maine, there's this one big area in northern and eastern Maine, and then 8 other dots pretty close together in the other parts of the state. So, but we're very pleased, and I can feel every one of those miles because I've been traveling them a lot, but I think it's very important that we're here and that we be here in person with folks. And that is another thing that I think is critically important for you to understand as we really continue to build this 3-county community action agency, is that we're not doing this in sort of a hub and spoke model. We're truly using the best talent across the 3 counties. I met yesterday with a couple of groups in Washington County and was talking about how we had just a recent opening for a Director of Human Resource position, and we had a very good candidate from Aroostook County, a great candidate from Washington County, and a candidate from Texas who was going to move to the area from away. And the conversation with the candidate from away, should they have been selected, was that they had an opportunity to locate anywhere in Aroostook, Washington, or Hancock counties and work in the community action office location closest to where they lived. So we really are taking the mission seriously of working and calling the best talent from the 3 counties and outside the 3 counties into the 3 counties. And we're working right now diligently to form that new 3-county community action agency. We had a gathering, some of the folks here in this room were there last week in Millinocket, where we brought leaders from the 3 regions together to advise us, to talk about what it is that they need from their community action agency. And a community action agency is structured in such a way that it ensures what we call maximum feasible participation. So we have a sector of our board of directors that are actually consumers, who are recipients of services that we offer each and every day, whether they're parents of children in Head Start or early care and education and childhood programs that we work with each and every day, or consumers that receive home energy assistance program support, are individuals who represent organizations who also work with people living in poverty. So that sector of our board, we had great representatives from our consumer sector of our board and other individuals who receive our services, who we started the day with on Thursday last week. And then we brought together community partners, individuals and organizations that we work with on a regular basis across the 3 counties to be able to serve especially vulnerable populations, and brought together community leaders and economic development folks, similar to the folks here in this room, to talk about what it was that they needed in partnership with their community action agency. And then lastly, we brought together funders, both program funders and private funders, to say, how can we better engage in supporting some of the mission work that we're trying to do in collaboration with you. So that was a very, very eye-opening and wonderful opportunity for us to listen as we begin to do the work of doing the 3 community action agency. So part of that is advising how we're going to be moving forward in terms of a 3-county board of directors. We will have representation from all 3 counties. Currently, it's a Aroostook County Action Program, but we worked on a bylaws revision and are working to actively engage board members in the next 3 months to become part of the 3-county Community Action Board. And then most exciting of all, from a perspective of not having to say community action in Aroostook, Washington, and Hancock counties, mouthful, and even the acronym, I always tease that the acronym sounds like something your cat is gonna hawk up. It's like, try pronouncing our acronym. But we'll have a new agency name and brand that's truly representative of the communities that we serve in 2026. So I did hand this out. I know this is probably very difficult to read, but I provided a handout for folks, and there's some more copies up here if you didn't get one, that really shows the programs and services across the 3 counties. Early care and education programs are ones that we offer across all 3 counties. We are the Head Start provider for Aroostook County and currently the interim Head Start provider for Washington and Hancock counties in a program that we refer to as Head Start Down East. And in so doing, we are serving families in unique ways, and I'm going to talk a little bit more about this, using the whole family approach, which is part of what Charles talked about in the introduction. One of the key opportunities that I think is important for folks to understand, and how thoughtful members of the Down East Community Partners Board of Directors were in ensuring the programs and services for this community continued, was the transition around early care and education programs. When the Head Start program had to be relinquished by that board of directors, there was the traditional thing that happens when a Head Start program is relinquished is a federal government team will come into the community and operate your Head Start program. It's not as simple as that sounds, because here in Washington and Hancock County, as well as in Aroostook County, there are childcare slots that are combined and blended and braided into the Head Start program. And a Head Start provider from a federal team comes in, and their proprietary concern are the Head Start program. So there was going to be a loss of service, and we all know how childcare is in a crisis situation across our 3 counties, and we certainly didn't want to lose slots. So the ability for that smooth transfer to happen with our Head Start program, and we had already been providing some leadership support to Down East Community Partners in that program, was really especially helpful in terms of ensuring those programs and services continued. And that, frankly, in the work of both the Down East Community Partners Board and the ACAP Board, was our guiding North Star throughout this process. It was about preserving the programs and services and ensuring the people of all 3 counties went uninterrupted with the critical programs and services that we offer. The other basket of programs that we offer across the 3 counties that we have in common are the traditional energy and housing programs, the Home Energy Assistance Program, which is a lifeline, especially for our seniors, our vulnerable seniors trying to age in place in our 3 counties, and families with young children. You know, I can tell you that it has been absolutely heartbreaking that the federal government program did not open on November 1st. I was sharing with the nonprofit group and the funders network here yesterday that the stories on the first day alone of emergency fuel season, within the first 2 hours, we logged 900 calls across the 3 counties for people with emergency fuel. People who had been without fuel since March and April of last year in their tanks and knew that November 1st was the day that the emergency program opened, that did not have access to those programs. In Aroostook County, where we had done our telethon just 2 weeks prior, we thankfully had some of those dollars that had come in, but I've never seen it at a point where we were actually prioritizing households that we were allocating emergency fuel to that had individuals aged 90 years and above in the household, just to make sure that we could get by with the funding, the limited funding that we had on hand that was private donor dollars at that point, and families with very young children. Here in Down East, our office logged 2 calls that I shared with a couple of groups yesterday that were particularly poignant, and that we shared with Washington Post and other media entities to really try to raise awareness about the very real consequences of what was happening in people's lives. A mother with a 2-week-old baby who was taking that baby to and from her car because she had fuel in the car but not fuel in the house to keep that baby warm. An elderly gentleman here down east who was needing to be discharged from the hospital, and the hospital wouldn't discharge him because he didn't have fuel in his tank to be able to get home. Thankfully, we were able to make those allocations, but those are real stories of the consequences of what had been happening there. And so this program, and I'll share with you the statistics in just a little bit about the energy and housing programs that really demonstrate how much of an impact they have here in Washington and Hancock counties. The other thing that we do across the 3 counties that I'm especially proud of is our coaching and workforce efforts. We are the WIOA Workforce Innovation Opportunity Act provider in partnership with Eastern Maine Development Commission. We provide the services up to CALIS under ACAP, and then for the remainder of Washington and Hancock County, they're provided through Eastern Maine Development Corporation. I just last week at our summit talked with Lee Umphrey about that, and we're hoping to locate the workforce development team member from EMDC at the Avery Lane facility in Ellsworth so that we can have that cross-work collaboration that happens in Aroostook and part of Washington County with our family coaches. But the family coaching model is one that we learned and we got our roots from right here in Washington County with Family Futures Down East. It was our shadowing of that program and of Charlie and Marcia Sloan and other families, and hearing family stories, that we built the infrastructure of our program in Aroostook County, and then have been able to mentor other CAP agencies, including Down East Community Partners, to adopt a whole family lens model for the agency. And then we have 2 other baskets of programs that are specific to parts of our region. Aging Services is a program that's offered in Washington and Hancock County, specifically Friendship Cottage, which is in Hancock County in Blue Hill. And that provides adult day services for individuals, and that's been a legacy program of Down East Community Partners that we're working really hard to try to preserve for the counties. There are some challenges there. There's some funding challenges in terms of making ends meet with that particular program and ensuring that the facility that it's housed in is secured, but we're working diligently on those. And then additionally, we provide the prevention and wellness services through what was the former Healthy Maine Partnership Network and what's Healthy Acadia here in Washington and Hancock counties in Aroostook County. And again, those abilities to have those partnership conversations with partners like Healthy Acadia and others are critical so that we can ensure in our footprint and in our work of trying to support families in a holistic way that we engage partners where and as often as necessary. We also, on the back side of your handout, is this just to demonstrate to you the breadth and scope and reach that we have across the region. These are our locations. These are where we are located. I will note that when I'm going to talk about this as well, that we are embedded in several public schools across the 3 counties in public school partnerships, including one very exciting one that the folks in Easton up in Aroostook County have embraced. In the fall of this year in Skowhegan, the Margaret Chase Smith School opened up using a model of a true community school where parents can drop off their children as young as 6 weeks old for infant and toddler care at the same school that they're dropping off their 2nd or 3rd grader. And the town of Easton asked us to open a child care center in their community, and we said, standalone child care centers are expensive to operate, and you see them closing throughout the region. We're really looking at this model moving forward. And we've been having conversations in Aroostook County with public schools that are on the list to have new school buildings built about incorporating this and using the Margaret Chase Smith School model. But we're also having conversations right here down east. The Bucksport School Department, for example, is very eager to adopt a model like this. And we're continuing to have those conversations here in the 2 counties in Washington and Hancock County. We're working on trying to secure the 5-year federal Head Start grant, and once we're able to do that, then we can institute some of the changes in the footprint and where we offer programs and services. But for right now, we're caretakers of that program and taking that very seriously as well. One of the realities of the circumstance of how things evolved between ACAP and Down East Community Partners is because it's not a merger, and that was intentional because there were some liabilities that our board of directors wanted to be certain that in order to maintain our viability and the viability of the 3-county CAP agency we didn't take on. Neither were those assets. So we're trying to work really hard to reestablish a footprint in locations across Hancock and Washington County. Thankfully, the Avery Lane facility in Ellsworth that is an early care and education center primarily for Head Start services was a facility that had federal interest in it, so that has transferred over, and we've consolidated all of our Hancock County services from energy and housing and the like to that particular facility. In Machias in particular, we're trying to work with Sunrise and other folks in the room to have a new physical footprint there because that building was sold. And thankfully in Calais, our partnership with the municipality in Calais that had been extended to Down East Community Partners has continued with the 3-county Community Action Agency, and that's actually where Tracy Collins, our operations lead here in these 2 counties, is based out of at that Calais office. But the other exciting component of bringing the counties together is one of the lessons learned that we had during the pandemic is we saw customers who, we usually have a number of customers who don't make appointments, and there are various reasons for that. So we noticed during the pandemic when all of our services moved over the phone that customers weren't missing appointments. And so after the heating season was over, we went back and we surveyed our customers and said, you know, what made it convenient for you to come to your appointment this year? And obviously the phone reality was what was the driving force. But folks in the past were having to have their children drive them to appointments or borrow someone's car, or transportation was a huge barrier. So we sat down with our Aroostook Community Collaborative and said, how can we partner on an initiative that would bring our services closer to the people? We had a request from Van Buren, the town that I grew up in, to open an office and a location in that community so that we could have a shingle there and be very visible with our services. And even though we offered remote services there and we went to a local community center, they were feeling we weren't as visible as we needed to be. So we brought that back and had great conversations with the Aroostook Community Collaborative about an initiative that would be able to sort of tackle what was on our list of a community needs assessment of transportation. And the idea was born for a mobile service unit that we then approached Senator Susan Collins' office with, and were successful through Senator Collins' office in receiving congressionally directed spending to develop a mobile service unit in Aroostook County. And we take the mobile service unit to rural remote communities where we don't have office locations and do agency intake there. And I say agency intake, folks will come to us for scheduled appointments at the mobile service unit, but folks can also walk up to the mobile service unit. And we were also able to purchase a fleet of vehicles through the congressionally directed spending that allows us to be able to go pick up, for example, seniors or individuals with mobility issues that might live in the community and still have a challenge getting to the mobile service unit and bring them to the unit to receive services. And so we will be bringing that mobile service unit into Washington and Hancock counties to the rural remote communities in the coming season as well. So that's another advantage of the work that we're doing collaboratively. So I mentioned last week that we held that work session in Millinocket to really listen to our consumers, to our communities. It was, I think, such a beneficial opportunity for us to connect with people across the 3 counties and to really listen and to engage with their voices. And at the end of that session on Friday, members of the former Down East, or the current Down East Community Partners Board of Directors and the Aroostook County Action Program Board of Directors, both in person and some joining remotely from the counties, gathered together and went through the task of working with an attorney and with the State Community Services Block Grant Office to go through our bylaws and to revise our bylaws so that they reflect the new reality that we're working with. And we will be working toward that and seating in 2026 board directors, a new board of directors that will represent all 3 counties and be ratifying our revised bylaws. So that on the backside of things is some of the mechanics of getting the work done to make sure that we're able to serve and have the voices of the 3 counties on our board of directors as critical decisions are made about programs and services and new directions. And that's really where we want to head in, quite frankly. When I look at where we're at as an organization right now, I will say that in my 10 years with Community Action, I have never felt that we have been at this critical a juncture in terms of the need that people are turning to us and the scarcity of resources that are available. I will say that we had a large number of people. We saw 10,000 more households turn to us in need in Aroostook County during the early months and years of the pandemic, but we were resourced and we had the ability to serve and resource them. And now folks are sort of have experienced 5 years of cost of living increases that are that folks on a limited income just cannot sustain. One statistic that I often quote is that in the 2019-2020 season in Aroostook County, we were serving 4,700 households with home energy assistance, with the home energy assistance program. This year and for the last 3 years, we've served 7,500 households. Seniors who used to be able to say, we will figure out how to get by, we have meager savings, we won't go out to eat once a month anymore, we'll turn the thermostat down by another 5 degrees, whatever the case may be, can no longer anymore. And so we're going to be working here in Washington and Hancock counties because those numbers didn't increase as substantially as they have in other parts of the state. And unfortunately, prior to last year, the 2 years prior to that, the program in Maine for home energy assistance was oversubscribed. We got a little bit of a relief last year that not as many households applied. So I'm hoping that we can be more proactive with supporting individuals, vulnerable households, in getting into that program because we know that the need is there. So the other part of what we're really trying to work on internally, which I think is absolutely critical, is that we want to make sure that the voices of our team members, the folks that are doing the work, the folks that are receiving those gut-wrenching phone calls from people who are struggling right now, that we both culturally support them in that work, but that we help to have them understand the work that we're trying to do across 3 counties. Members of our management and our leadership team are already doing the work across the 3 counties. We have the best of the best talent that came from the Head Start Down East program and the early care and education programs in Aroostook County. We built a cross-county leadership team. The energy and housing program lead was Down East Community Partners. She's now leading the programs for all 3 counties. We've really tried to do the best that we can to help leadership and management understand the new work that we're trying to do across the 3 counties, and we want to support our staff in doing that as well. Staff here down east have been through a very difficult period of time where there was uncertainty about their employment and their programs and things of that nature, and so we're being very careful to be able to support our staff, and we're holding listening sessions, and we're doing some trauma-informed work with them, and using the restorative practices model that the management team at ACAP has been trained on, and extending that into Washington and Hancock counties as time goes on to ensure that we're supporting those needs. And then we're going to look at things like how we celebrate our team and how we build recognition events, and with all of that, keeping our core values as an agency in mind, being that we're innovative, we're collaborative, and that we're accountable to each other and to our community. So one of the things that we've done as a result of the work of coming together is community action agencies work through what is called a community needs assessment. We're required every year to conduct a comprehensive community needs assessment. And this was the year, 2024, and it was released in 2025, was the year of the comprehensive community needs assessment for the state of Maine. And I say that because in the last 6 years, we've done some great work on the backside of our community needs assessment to do some critical alignment that was necessary. Community action agencies across the state were on various cycles on their 3-year assessment, and so we first aligned all community action agencies, now 9 community action agencies across the state, on the same community needs assessment cycle. So we were all doing the same. So in 2021, we all did a comprehensive community needs assessment. And then in the intervening years between 2021 and 2024, we started working with the state hospital systems to align with their community health needs assessment, which is already needing to be done every 3 years as well. So we brought together some of the determinants of health and the social determinants of health together in one comprehensive survey and one comprehensive process. We have some tweaking to do before the next one because we're finding we're not as data rich on some of the social determinants of health data that we could otherwise be. And so we're learning the lessons from that. And in 3 years, when we go back out to our community, we'll have a different survey tool and different questions. But it's been really helpful to do that alignment because there's a lot of work around social determinants of health happening on the health side of things, and certainly with your community action agencies and other nonprofits. So we did a crosswalk prior to bringing our managers from the 3 counties together for a strategic planning session, which we limited to 2026 because we really wanted to focus on 2026. And if you look at it here, there are a lot of similarities between the concerns, the top concerns expressed by community members in Aroostook, Washington, and Hancock counties. And so we further took that data and we looked at it from this perspective, where all 3 counties really cite housing, the availability for providers, that's healthcare providers in this particular case, nutrition, and mental health as priorities across the board. And then you can see there are similarities that Aroostook and Washington share in common, Aroostook and Hancock, and Washington and Hancock share in common. I will say that these are not exclusive. Obviously, there are many community needs that were expressed. These just represent what ranked as the top in each area. And so we took this data, brought our management team together and said, what are we going to do within our agency and networking with community partners in 2016 to begin to work on addressing these issues, understanding that we also have to work on our internal capacity at the same time. So doing that work together and at the same time is critically important. We'll also be working in 2016 on establishing our own next 5-year strategic plan for the 3 counties. So that process will be led by folks from all 3 counties and be inclusive as well. But our goals and priorities at the agency level, and again, I'm talking about those that we need to ensure the integration continues to work, is to explore opportunities to collaborate and partner with community entities. That's top on our agenda. We recognize and we realize that we can't do the work alone, and there is such a wonderful and rich tradition across the 3 counties of organizations coming together to support one another. I had the great opportunity to meet with the Down East Nonprofit Network yesterday, and that collaboration was very clear in that room, and people are just figuring out ways to get things done by bringing people together in the right room, in the right space, and having the right conversations, and then mobilizing. And we want to be at the table to be part of that conversation and do the part that we can in community action. We want to also join in community events and work to build and understand trust. We understand that here in Washington counties, we have some work to do to rebuild trust in your community action agency, and we're committed to doing that. In Aroostook County, our challenge is a little bit different because our brand, we are a well-known entity in that county, and our brand is going to change, and we're going to be working with our community to understand that we're still their local provider of community action, and that we have this new extended family that we're very pleased to be working with. We're going to also work to increase our understanding for staff of our agency programs, as well as our policies and core values. So we're trying to bring all of that together. We're going to revisit and refine our agency mission statement, which community action agencies are also required to do as part of our community services block grant, regular priorities that we're evaluated on every year. There are 52 standards under the community services block grant, and one of them requires a periodic review of our mission statement, so it's timely that we're going to do that. And then, as I mentioned, develop that 3-county community action 5-year strategic plan. So specifically in areas of work that we're looking at doing in some of the major concerns that have been identified in the communities through the community needs assessment, and I will note, childcare is not one of the ones that rose to the top in any of the surveys, but we know, experientially, we know it is one, and it is one, quite frankly, that we have the opportunity to make a true impact in the work that we do because of the Head Start program in particular, but also partnerships with public schools that we're engaging in and in the private childcare sector. On the transportation side, it's obviously well known that one of the programs that we did not carry forward from the former Down East Community Partners to the new 3-county Community Action Agency was the transportation program that Down East Community Partners operated for a number of years. A couple of phenomena had happened there. One is that the program had already the non-emergency medical transportation section of that program and service had already migrated to other partners in the region. Motive Care had been finding that the reliability of rides wasn't there, so they had already brought in other providers into the region, including RideSource. And so we had great conversations with Motive Care and with RideSource, and there was really no pathway forward to bringing that work back to the Community Action Agency unless a provider would have left the area and we would have sort of been the provider of last resort. And it really wasn't feasible for us to continue to be able to operate in that regard. The Department of Transportation contracts that the Community Action Agency had, we were able to work in partnership with our sister CAP, Waldo Community Action Partners, which operates a transportation program, and we're able to work to have those contracts transferred over to Waldo to be able to continue to provide services that had been provided in Washington and Hancock counties. So it really was using the expertise of the right partners at that particular time. But our ability to be able to reach customers, and what we're looking at doing is sort of that same paradigm shift we did in Aroostook County, is not trying to say how do we get the customer to us, but how do we get to the customer. So in addition to the collaboration with providers, expanding our mobile service unit into Washington and Hancock counties is one of our goals in transportation, and then to increase local volunteer drivers for customer transportation, particularly in our elder care services program. That's one of the impediments to being able to get folks to program, as well as sometimes in childcare. In childcare, we're going to work to secure the Head Start 5-year grant for Washington and Hancock counties. I breathed a huge sigh of relief for a number of reasons when the federal government shutdown came to an end, because Head Start programs across the country, unlike other federal fiscal programs, have different federal fiscal start years. And it just so happens that the Down East program has a federal fiscal start year of December 1st. And we were told in a Head Start providers meeting that people shouldn't worry except you, and they pointed at our Head Start director with Head Start Down East, because you're an interim provider, and if the funding elapses, you really have no status. And so we were really anxious that we were scared about what was going to happen with that program on December 1st. So they're already behind because the RFP for the Head Start program was supposed to be released in October. That hasn't happened yet. And the Federal Office of Head Start missed 2 transition meetings because there was nobody there in the month of October and November. So we're going to work on that grant. We're going to grow a workforce through partnerships, and we're talking about the workforce. Our greatest impediment in expanding early care and education opportunities, childcare, Head Start classrooms, public school partnerships, is in the inability to find the workforce to do that work. So we have a concentrated effort working with higher education and CTE, community technical education centers, in public high schools, to help grow the workforce through partnerships. And then look to increase or expand our public school partnerships across the counties by 2 in 2016. In housing and energy, we're going to extend what we call our agency intake best practices across not only our footprint, but to be able to support other community action agencies in doing what we call that agency intake. So we no longer have customers that come to our agency for a single purpose appointment. When they come to our agency, we assess them, or we provide them the opportunity to assess them for all programs and services that they're eligible for, including coaching services, if we have capacity for coaching services. And it really is in that holistic way that we're able to work with families to be able to ensure economic and social mobility. And where there's not a vulnerability there, like a senior, where we're able to work with them every year to get home energy assistance to be able to stay in their home, we're working with families towards pathways to employment for the parents while we're working on the quality early childhood education experiences for the children. We're going to work to continue to standardize the processes across the 3 counties in energy and housing. We've got some work to do in Washington and Hancock counties to restart our housing program services. They really kind of withered on the vine, and there was no personnel left in the housing programs by the time we came to the table. So we've got some work to do with Maine Housing, and we've got some work to do here in the 2 counties networking and connecting with local contractors. We just successfully hired someone, I learned yesterday, that will be working in Washington and Hancock counties that comes to us with the appropriate certifications to hit the ground running, because oftentimes that's a several-month delay in getting programs and services. And we're moving staff across the 3 counties as we need to be able to provide those services and get the work done across the 3 counties. So looking forward to that being an important part of our work moving forward. In aging services, as I indicated, that's a program that we're watching very closely. We're being very candid about the fiscal assessment that we've done on that program. It's running right now. Again, we're moving things into our books at ACAP, and we're getting a better understanding of just how much of a deficit we were looking at aging services, but our projected pro forma on that program this year is either side of a $200,000 deficit without any other funds like CSBG dollars infused in it. And then we have the complicating factor right now of this facility that houses the elder services that is not our property and is likely going to be put on the market. So we're really trying to figure out a way to sustain this program, and all ideas are on the table. And then obviously, to help with that, pursuing grant opportunities to fill gaps in funding. I have made the commitment to the people of Down East and to our board of directors at ACAP that we will make no decisions on this program without giving it our best shot, and until there are people from Washington and Hancock counties on our board of directors. It is simply not fair for us to make that decision as an Aroostook County Action Program, Aroostook Board of Directors, and I'm very sensitive and concerned about that process, and we're being very transparent with the staff, and we're being transparent with, we brought community donors together and showed them the pro forma budget, and just really want to be clear and eyes wide open about that there is an uphill battle there, but we're working to try to close that gap if we can. Prevention and wellness services, again, it's about exploring and collaborating to make sure that we're partnering well in those services. Coaching and intake, and I'm going to talk about that in just a minute here, is about standardizing our assessment and intake process. We do a really good job of connecting with customers, and have done a better job in various parts of the county, but our customer service initiative is going to look more similar across the 3 counties to ensure that whether you're in Calais or in Caribou, you're getting the same kind of access to your community action agency. And then fostering increased family engagement in all of our work with whole family. This has always been our Achilles heel, if you will, whenever we've had an assessment done. Part of that was because our work during the pandemic required families to go. Actually, we were doing some of our best family engagement work during the pandemic because parents were participating. They were coming in on Zoom, and they were working on family engagement and how we engage families with one another and building that social capital that's absolutely necessary, but also helping to support them. One of the ways that we've done that is by positive parenting program that we were lucky to pilot in Aroostook County, and are hoping to continue and expand here into Washington and Hancock counties. How we do this work and where we center this work, and I realize this again is hard for you to make out, is by using the whole family approach. This is the Ascend model by the Aspen Institute that really shows you how interconnected things are in the life cycle of a family, and how in any one of these sort of gear shifts, if something goes wrong, it can bring the entire system, an ecosystem of a household, to a screeching halt. So when we work with families in Aroostook and now in Washington and Hancock counties, because we have coaches across these 2 counties, and we help at ACAP to mentor Down East community partners in this work, these are specifically for families with children who are engaged in our early care and education programs, who have the opportunity to access what's called a family coach. And essentially that family coach rides in the passenger seat with them. The family is very much in the driver's seat. And they work with them on assessing them on 19 different domains. Everything from food security to housing security to energy security, all of these areas here, mental health, physical health, their economic assets. We do financial literacy training with the families, and we measure them, they measure themselves on a crisis to thriving scale of 1 to 5. So for example, if They worry each and every day about how they're going to get food on the table. They're a 1. Whereas if they can go to the grocery store and not have to worry about what they pay, or none of us can do that now, they're a 5. So what we find in doing this work, and we've had Senator Collins, we've had Senator King, we've had the commissioner of DHHS, the prior commissioner of DHHS, Jean Lambrou, come to our office, and we show them the data. We show them the data. And if you were to just take it on the first 6 months alone, it looks like a horrible failure. Because essentially what happens is relationships are built with our coaches. And that work is critical. So a family, when they start their work with a coach, they will assess themselves. If they truly are worried about how they're going to get food on the table every meal, they're not going to admit that to the coach, because these are families oftentimes who are used to being involved with the child welfare system and are potentially afraid that if they say this, that they're going to lose their children. There needs to be a trust built. But by the 6-month interval, that relationship has actually been grown to the point where sometimes we see some of the scores drop because they're able to be vulnerable and they're able to have those conversations. And then it would further look like a failure because in the process of doing that, we're connecting them and we're networking them with more social support services, with programs that they either didn't know existed or, quite frankly, that they had the perception that if they did one, they couldn't do the other because it would knock out the first. We literally, when I came to the agency, when I came to Aroostook County Action Program 10 years ago, I looked at the data and I said to my Energy and Housing Director, there's a precipitous decline here in the number of families with children under the age of 5 applying for the Home Energy Assistance Program. Why is that? Our demographics aren't dropping that fast. Something is wrong. So we engaged our very first family coach and surveyed our families, and there was a perception at the time that if you applied for HEAP, you were going to lose some SNAP benefit dollars. And it was actually completely the opposite, but it was a complete misperception. So we had to work with families in a cost calculator to show them that it was actually the absolute opposite, to build confidence in them to reapply for this program. And then once we did that work and we said to households, okay, we've helped to get you out of crisis, you're no longer worried every day about how this is going to work, then we can have conversations about aspirations. And our data collection system was horrible at that time, but when we got to the end of the year, and Sue Powers, our Director of Early Care and Education at the end of the year, was collecting data to be able to report back to the Federal Office of Head Start, we actually showed in the cohort that we were working with a 100% increase. We doubled the number of families that had an adult in the household working towards some kind of a credential, whether it was their high set or working with a community college on a certificate or an associate's degree. And we're like, yes, it's working. It's really working. So this is the approach that we used at our agency, and thankfully, again, Family Futures Down East was the forerunner in this area. We followed their lead. We were fortunate enough to be selected as one of 10 community action agencies in the country to participate in a national community action partnership cohort where we went through intensive training and technical assistance, and we're now part of a peer expert corps where we're supporting other community action agencies across the country. At the end of September, I flew to East Missouri on behalf of National Community Action Partnership with another CEO to mentor an agency. Next week in Presque Isle, 9 members of that team are flying into Presque Isle to spend 3 days with us, as is the head of the National Community Action Partnership, Denise Harlow, to spend 3 days on the ground with us to say, help us understand how you did this. And that's, I think, an extraordinary compliment to the work that we're doing, not only in Aroostook County, but that's happening in Aroostook, Washington, and Hancock counties. We've taken our organization and we've realigned our organization around that the Aspen Institute model, in seeing both how we align our programs and services and how they overlap and how they interact. We built what we call a matrix organization. So there are work teams that don't report just up and down the traditional vertical organizational chart. And so what we've done is we've taken our programs on the far side there and we've aligned them into the health and well-being, early childhood development, and economic employment and social assets. And where do those programs intersect? And we have collaborative teams that work across these programs to engage in the work. And then we were asked to speak at on a national webinar about how do we engage our partners in the whole family work. And so we did the same thing. We did this 3 concentric circle models where we looked at who are our practice and family outcome partners, who are those that advocate and do the advocacy and advancement partnership work with us. And you'll see Senator Collins is one of those, because the work that Senator Collins has done with New Mexico Senator Martin Heinrich to introduce what's called the 2-Generation Economic Empowerment Act really is what would help organizations and agencies like ours not be fish swimming upstream on this effort. It really, if that act were to pass, and she's introduced it a couple of times now, and the second time she actually used family stories from our agency and the work that we were doing in her introduction of the bill, and it would help us to not have to do the crazy blending and braiding work that we do. The work that we do is difficult enough on the people that do the work, but the ability to be able to do that work and to not have to play whack-a-mole to do that work, because we're literally having households that present to us and say, my car has broken down, I can't get to work, can you help me fix my car? And we're like, well, unless you qualify for the WIOA program, we really can't. And if you're gainfully employed and making above a certain amount, we can't get you in the WIOA program. But maybe you have young children, so let's qualify you for WIC, or let's get you into HEAP, and then you can save up to pay for the car repairs, the whack-a-mole. But then by the time you saved up to pay for the car repairs, you will have lost your job because you can't get there. And that's the kind of insanity that needs to stop in the work that we do, because we're not able to triage the immediate need that could prevent something far more cataclysmic down the road. So the 2-Generation Economic Empowerment Act would be a critical piece to help us advance that work. Lastly, I just wanted to wrap up by sharing with you the impact of your community action agency here in the region, specifically here in Washington County. And these are on statistics from last year. Here last year, almost 1,800 households received home energy assistance in Washington County. I do believe that there are a number more that could qualify for that, and we're going to work toward that. But that was a value of almost $888,000, $1.7 million in the Down East region alone. And those go directly to fuel vendors. They never really touch the household account. They go directly to the fuel vendors in the region. So when you talk about economic spin-off, just like when we employ contractors when we're actively doing housing, those go into the private sector as well. The Energy Crisis Intervention Program, which is the emergency fuel assistance, which is what is not happening right now, and we need to get going again, there was over $90,000 here, distributed here in Washington County alone last year. Early care and education programs. In Calais and Machias alone, you can see the children that we serve there. Machias, the Flaherty Center on the University of Maine at Machias campus, is our second single largest location, because in the Bucksport School Department, we actually co-enroll all of the preschool children into the Head Start program. So that's why there are 47 children there. But that Machias Center, the Flaherty Center on the University of Maine at Machias campus, is a bustling center for us. Total children served in early care and education across the 2 counties, 128. And then the whole family approach, we currently have 48 families enrolled in our whole family approach across the 2 counties, working actively with family coaches on those 19 different domains that I spoke about. So I've blown right through my time and come right up to 10 o'clock. I'd be happy to connect with folks. I want to make sure folks get their break, and happy to take any questions one-on-one, or if you feel that your question now would have benefit to the full room, I'm happy to take that as well. But I want to thank you for the opportunity to come before you today and share with you the work of your community action agency and the wonderful team of people each and every day who are making this work happen under some pretty challenging circumstances. So my hat's off to them. 2 of them are here in the room, but so many of them are back in their offices and classrooms doing their really good work. So thank you so much.